So May is Trauma Awareness Month, and obviously we want to get the word out there to make people think more about not getting into trauma. Basically, we're in this weird position as myself as a trauma surgeon. I would be very happy if I didn't have any more work in terms of trauma. I could keep myself happy with general surgery. So we just want to make sure that people are thinking about, with summer coming up, all the things that they're doing and all the fun things they're going to do. Have fun, but have fun safely, and make sure you don't end up meeting me because you don't want to meet me professionally. My name is Terence O'Keefe. I'm the Division Chief of Trauma here at Augusta University Medical Center. I'm originally from England, as you can tell by my accent, and I came to America because America has an organized trauma system. Up until recently in Britain we didn't have that, and frankly I used to always joke that Americans drive worse than Britons, therefore we have more vehicular trauma, but we also, it's a sad fact of life, there's a lot more guns in America, and so we don't have much in terms of that kind of violence, and so there's much more of a need for it. And just last week, for example, I was on night shift and I looked after many victims of gun violence last week, including some of the people you read about in the newspaper. So trauma surgery is basically, if you think of it, it's probably the best way to describe it is think of it in terms of trauma centers. And so we have here at Augusta University Medical Center a level 1 trauma center, which basically means we are ready and able to deal with absolutely anything, whether that's somebody who gets in a car crash, somebody who falls out of a tree, had that last week, somebody who gets shot, had that last week. We're ready to deal with mass casualty events if a bus crash were to occur. And so I literally stay here in the hospital, me or one of the other surgeons stay here in the hospital 24/7 to make sure that there's somebody here and ready to go. Our operating rooms are ready to go. One of the patients who came in the other night, we spent 10 minutes in the emergency room and then whisked the patient straight to the operating room to operate on them to save their life. So having that sort of capability and that readiness and that flexibility is what makes a level 1 trauma center. Both from my standpoint, having orthopedic surgeons, neurosurgeons, other specialists, and then we have the ICU capabilities to look after patients, and also as they get better, when they go out to the ward, helping them with rehab and getting them into rehab centers when they're ready to leave. Well, it's all about, I would say, having fun safely. So for example, if you're out riding your bike, my kids are just learning to ride bikes, wear a helmet. If you're out zip lining or doing something fun in the trees, wear your helmet. If you're driving, drive within the limits of you and your car. I'm not going to say everyone who's human breaks the speed limit. The speed limits are there for a reason. They're really there to remind us what's safe. But please don't drive drunk or impaired. Driving sleepy can be as bad as driving drunk. Driving on drugs is again a bad idea. It's really just being sensible, and just being sensible doesn't mean you can't have fun, but designate a driver, make sure that you know the capabilities of yourself and the vehicle you're using, and be safe. Another thing, there's a lot of swimming pools in this part of the world. So it's warming up, it's getting to time where we're going to start swimming again. My kids have already tried getting in the pool. Watch your kids in the pool. If your kids don't know how to swim, make sure there's an adult watching them. There's really no reason why anyone should drown in a swimming pool. So these are things, it's really sensible things, that's all.
What is
So we're really good at fixing the physical stuff. We're pretty terrible at fixing the emotional stuff, frankly. And there's not a lot of resources for people in general for that kind of the emotional side of trauma. And a lot of that just unfortunately gets left to the family and the patient by themselves. In terms of the physical rehab, we're obviously going to try and repair whatever injuries, whatever trauma has gone on. Some patients will need to go to rehab centers. In this facility, we don't have an attached rehab, so all the rehabs are private centers, for lack of a better term, where you get sent after your trauma. And a lot of those places will have counseling. But in general, you have to bear in mind that if you have a traumatic event, say you get in a car crash, and it's a bad car crash, and you break a leg, and you break an arm, get a little bit of a head injury, you're in hospital for a week or two. That doesn't impact just your physical limitations at that point. It's going to impact your job, it's going to impact your relationships, it's going to impact your family, it's going to impact you going back to work, it may impact your finances. So there's a huge knock-on effect from all these things. Some of which we can help with. We can fix your broken leg, we can monitor you, make sure your brain injury doesn't get worse. But other things, we here in the hospital, we can't fix your finances if you lose your job because you get in a car crash. We can't fix your family relationships. And so those things that's kind of one of the sort of the hidden aspects of actual trauma. And those things can persist. People can be totally cured from their trauma after a month or two, but those kind of things can persist for months and maybe even years after it. So that's why the reasons why Trauma Awareness Month, we want to make people aware that it's not just the trauma, it's not just you forgot to take the round out of your gun and you accidentally shot yourself. Had that happen the other day, or you were not paying attention and you ran off the road and hit a tree. That happened the other day. This happens all the time. It's not just the actual initial trauma, it's the downstream sequelae of that which patients can suffer from a lot longer. So PTSD is a very specific, defined psychological condition where you inappropriately relive the trauma that you've gone through or some of the consequences of that. And so it's an abnormal response to trauma. Just like you've probably heard about the 5 stages of grief, and you kind of gradually work through those when something bad happens to you. Eventually you're meant to get out the other side, when you're meant to get to acceptance, and you move on and you get better. PTSD, you get stuck within those, and so it can be very disabling. For people. I mean, we all know the stories of the people who came back from Vietnam and suffered very, very badly from that. But there is a baseline of PTSD in trauma patients that we don't really do a good job of diagnosing. It's not easy to treat. It's not something, depression in a way is relatively simple. You give somebody an antidepressant, most of the time they get better. PTSD isn't as simple and straightforward as that. And again, we have resource issues. There's hundreds and thousands and millions of Americans who are either uninsured or underinsured and who don't necessarily have access to the kind of services for that. When we talk about trauma, when I talk about trauma, I'm talking about the physical trauma. When you're talking about PTSD or the emotional trauma, that's something very different, and that's something that's a lot harder for us to get a hold of. And obviously, prevention is much better than cure. And there's significantly more trauma in this part of the world, and I don't mean Georgia, I mean the United States, than really there needs to be. We're not good about wearing our seatbelts, we're not good about drinking and driving, we're clearly not good, as we read in the newspapers every day about interpersonal violence. And there are also just other significant challenges. I mean, this is still a wild country. People get mauled by bears, eaten by mountain lions, bitten by snakes. I mean, there are plenty of things. There are wolves, bears, moose, poisonous snakes. I'm trying to think of what other significantly large animals we have in the mountain lions, wolves. There are things out there that can kill us. It's hard enough without us trying to do that to ourselves.